Welcome to Faith and Science program. Be blessed as you watch.
So just to a little bit talk about the first IVF baby. This was well, not a baby, but the first IVF pregnancy. This was in Australia, where in Melbourne, where some professors at the time tried to make a patient pregnant. They took the egg from the ovary, they fertilized it with the sperm. They opened the tummy of the patient and they put the embryo back inside the womb. This was of course a very invasive operation which they have to cut and do big operations, and this was done in 1973. Unfortunately, the patient got pregnant but then miscarried due probably of an infection in her tummy where the wound opened up and they had to do another operation. But this in fact was the first IVF pregnancy, but unfortunately didn't go on. The really first IVF baby which was born was in 1978. And this baby, we all know, Louise Brown, was born after an operation to her mother, where an egg was taken away. This was fertilized with the sperm of her partner, of the father of Louise Brown, and then the embryo was put back inside the womb of the mother, and she got pregnant, and then 9 months later delivered Louise Brown. And then a few years later, also the same happened, and she delivered again a sister of Louise Brown. In the meantime, Louise Brown herself, who became a nurse, got married and got pregnant herself spontaneously, without any treatment, and this proving that if your mother has IVF, it doesn't mean that all the children afterwards need IVF, and there is no problem with fertility in the children born of patients who had infertility problems and who needed IVF previously, which is quite reassuring. Now, for the future, I think the future is genetics. And genetics is for us, who are doctors who are already a little bit older, something very confusing, because at our time, when we were in the university, not much about genetics was known, and we didn't get any courses in genetics at all. So all these new things that now appear about genetics are completely new for us. But I think this is the future, and genetics will play a part in all branches of medicine and also in the fertility treatment. And the first thing that we do now, and we also do here in Kampala, is that we can do PGD, which means pre-implantation genetic diagnosis, meaning that we can analyze the embryos that we make, and we can see if these embryos are, for example, female or male, or we can see that these embryos are abnormal, like trisomy 21, trisomy 18, or if these embryos are sick, or for example have sickle cell anemia, yes or no, or other terrible diseases. And in this way we can avoid that parents who are at risk of having sick children have really these sick children, and we just transfer healthy embryos, and we do not transfer the sick embryos, so avoiding that these parents have sick children in the future, in the benefit of the parents, of the community, and especially for the children. And here you will see a slide where we see an embryo, where with the laser we make a little hole in the wall of the embryo, and then we remove one cell or even two cells of the embryos, and these cells we can then analyze if they are a sick embryo, yes or no, or if it's a male embryo or a female embryo, or whatever you want to know of the embryo. And I think this is really the future for reproductive medicine. And one of the cases that I wanted to present, we did in Brussels, was a family, a German family, who had a child. Well, they were both carriers of a terrible disease, a metabolic disease. And they already lost a few children, and it's a terrible disease. The children, they're born healthy, and then in the length of 2 years' time, they completely get sick. They get a very big spleen, a very big liver. They get severe brain damage, and in fact the parents see their children degenerating till after 1 or 2 years they just die, which is psychologically a terrible fact, to see your own children suffer and then see them die like that. And by doing this technique of PGD, we could avoid them to have another sick child, and now they are the happy parents of a healthy twins who were born some years ago, thanks to this new technique. Another couple from Switzerland, which made a lot of pressure in the media, was a couple where they had 2 sons. One was healthy, one had a terrible immunological disease. In fact, he was getting continuously abscesses, and it was known that probably he would live for 11, 12 years, and then probably one infection would kill him. He was living in a completely sterile tent. Nobody could get close to him, just avoiding that he would get sick of any bacteria or viruses that were near him. He could of course not go to school, not go play with his friends, and the only way to help him was to give him a bone marrow transfusion with tissue that was very close to his own tissue. Unfortunately, his parents or his brother were not so close, so they couldn't give him this transfusion. But we could make embryos and make him a little brother or sister that had the same HLA typing, the same bone marrow tissue that he had, and by giving a transfusion to him, this would probably save his life and he would have a normal life. So we did this. We did this treatment. The lady, his mother, got pregnant. She delivered from a healthy female baby who had the same tissue as her sick brother. We took the stem cells from this little girl and we did a transfusion to her sick brother. And in the meantime, this brother is completely recuperated. He is now at school, he plays football, he's a normal boy at his age. And in fact, his little sister saved his life. So by doing this treatment, which is a beautiful treatment, we saved a boy's life and we give birth to another healthy child, which is a double win. For me, this was one of the most rewarding treatments I've ever done in my life, with the positive results. And it just shows that by doing this technique, we can really help patients, families, children, not only to get more children, but also to save lives of siblings. Unfortunately, not all people are in favor of this technique, and some politicians, for some reasons that I never really understood, are against this technique because they believe that we will make babies with blue eyes and blonde hair and this and that, nothing to do with a medical indication. Of course, one, medically this is not possible, and secondly, we all have our ethics. These are difficult techniques. We will never go into that. So I think it's just not justified to be against this technique. We really help people by doing this technique. We can also do this biopsies on the embryos just to look at the embryos, and especially in women who are older, to screen their embryos to see if these embryos are normal or abnormal, because we know that women who are older, they have more risks of trisomy 21 or other abnormal babies, and they have more risk of miscarriages. And by screening the embryos beforehand, we can avoid to transfer embryos who are not normal, who might give an abnormal baby or even a miscarriage, and then just limiting the number of healthy embryos to transfer so they don't have these problems in the early pregnancy. And this again we can do everywhere, and it gives a lot of good results. Another new technique, and these are really recent techniques now, is something called Pixie. And in Pixie, which is a very elegant technique, we put a little drop, it's inside a dish, and this drop contains some enzymes. And what it does is, when we put the sperm in the same dish, this drop attracts only the mature sperm. And the mature sperm, they are attached to this drop, and in this way we select the best sperm, the mature sperm, the ones who most probably give the best pregnancy, and we don't take the sperm which were not so good. This is an elegant technique. It's a quite cheap technique. It's easy to do, and it seems that the results are quite promising. And the fact that it is cheap is also something that is very good. So it's something that will be introduced for all the patients, all the fertility centra, quite soon. Another technique that is introduced since a few years now is called IMSI. IMSI is a technique where, when we do the ICSI, the micro-injection of the sperm inside the egg, that we can see the sperm that we inject better. It means the selection, the choice of the sperm with the IMSI is better, meaning we have a microscope who sees the sperm in a bigger size, and we can see better if this sperm is normal, yes or no, avoiding that we use an abnormal sperm that to inject into the oocytes. Now, this technique is very expensive, because you need another microscope to enlarge the view, the image of the sperm, which is very costly. And it takes also much more time to do this for the people of the laboratory. Now, the results are a little bit confusing. Some people say that with these techniques they got much better pregnancy rates, much better results. Some other people say we did this technique and it did not change anything at all. So it's a little bit confusing if this technique will work, yes or no. Of course, there's a lot of pressure from the industry, the people who make this microscope, that of course they want to earn some money by selling this microscope, and they will push that this technique is better and that everybody buys this microscope. But of course we have to stand with our feet on the ground and see if it's really worth it to do this, yes or no. And I think the last word is not said about this technique. Next, another technique is called Makovan. It's a very elegant technique where we take the eggs of the patient, we put it together with the sperm in a little tube with some holes inside, and this little tube, we put it with the sperm and the eggs, we put it in the womb of the patient. So this is the best environment, this is the ideal temperature. Mother Nature made it like that. that this is the place where eggs and sperm should be. And in this little tube, which is attached with some threads, it's like an IUCD, like a coil, we put it inside the womb. We let them grow these eggs and the sperm to embryos, and then after a few days we take it out, we open the little coil, and then we see how the embryos are, and then we can take out the best embryos and put them back into the womb. It's like a sort of a natural incubator, which is much more cheaper, because it's Mother Nature who does it. It's much more closer to nature to let these embryos grow inside the womb. And in this way, we make the technique cheaper and also closer to nature. Now, the device is not completely what it should be up to the point, but people are working on that, and this in the future might be something that replaces the expensive incubators and might even increase our pregnancy rates. Other techniques for the future are, and then we go to the software, and everything is going to software digitalisation now, that we can follow the embryos in the incubator by looking at how they grow. And we can do this by putting a camera inside the incubator that takes pictures from the growing embryos every 5 minutes or 10 minutes or whatever we want to see. And in this way we can see how these embryos grow, and we can maybe, by looking at the growth and at how these embryos change to 2 cells, 4 cells, 8 cells, we can select the best embryos and say, look, this embryo and that embryo, we looked at the pictures, they are the best ones, they are growing fastest, these are the ones we should put back to the patient to give her the best chance of a pregnancy. But again, this technique should be more evaluated. It's an expensive technique, we have to buy all these cameras inside the incubators, and we have to wait that it's really proven that it gives us better results. Then other techniques that are now available are something called oocyte imaging system. When we do the injection of the sperm into the eggs, when we do the Pixie, the micro-injection, we do not see where exactly the needle of this, with the sperm inside, goes into the egg. By having this new imaging system, we can see in the egg where the polar body is and the spindle, and by this avoiding that we cut or we damage this system by doing the micro injection. Again, of course, it seems that it's a very promising technique and that we will probably avoid damaging certain eggs. But again, it's an expensive technique, and we still need to confirm that the results of this technique are improving our pregnancy rates. Then we come to the incubators. A lot of incubators now have become more performant, and now we have the latest incubators, like for example EmbryoScope, where we do not have to open the doors every time of the incubator to take the embryos out and to look at the microscope to see how, if the eggs were fertilized or how are the embryos growing. We can see this by putting a microscope inside the incubator, and through internet even we can see how the embryos are growing.
You are still watching Faith and Science. Be blessed.
Many souls continue to be blessed and accept Jesus Christ as their personal Savior and Lord during the Jesus Film Outreach Ministry in Uganda by the Faith and Science Ministries team. You can be part of this. Pastors and other leaders, please don't hesitate to call Faith and Science Ministries on 078 308 3556 for scheduling. Be blessed.
Another new technique is that we could check with very small needles inside the dishes of the embryos to check if changes metabolites in the culture media are showing us that these embryos are growing better, yes or no. If they are, we could change what we could check what we call respiration rate of the embryos to see that some are going better than others, and by this selecting the best embryos to transfer to the patient. I think the future, and of course this is all has to be still confirmed, is these incubators that are getting better, that they're getting closer to what Mother Nature wants from the embryos that normally are growing into the womb. We doing artificially in a laboratory, and we're getting more and more performant incubators, but of course more performant means also more expensive incubators, which makes increase the price for us and then of course for the patient to do the IVF treatment. There are all sorts of new incubators now on the market. We have to evaluate one against the other to see what are the best ones, and then of course hope that by buying and using more incubators we get better pregnancy rates and that the prices of these incubators go down. The new techniques are, and then we're talking really about very expensive changes in the lab, are that we sort of, when we take the eggs away from the patient, we put it immediately in an incubator where we can still manipulate these oocytes by putting the sperm together and by doing the microinjection, but still in an incubator environment, and that the embryos, the oocytes, the sperm, do not leave these environments up till the time that we transfer them to the patients. There are all systems made like that, but of course they are extremely expensive, and it's not for sure that they really make a difference for the patients apart from the price. Now some ethical changes, and also that I want to discuss is, for example, it all came into the news that in the United States a man got pregnant and delivered a child. In fact, this was a woman who then took hormones to become a man, and then realized that being a man he still had his feelings to become a mother or even a father, I don't know, and if he still had a womb, so he could get pregnant, which gave the confusing picture of a man with a beard and a moustache being pregnant and then delivering a healthy baby. This of course raises a lot of questions about ethics and by using these techniques, which I think should still be discussed, but this is really at the edge of the ethical acceptable. Then we come to the chapter of stem cells. Stem cells are all pluripotent cells that can go and grow to all sorts of tissue. They can become neural tissue, cardiac tissue, skin tissue, whatever we want. We can make them grow into that direction. And these stem cells, which we can take from embryos, we could in the future help to treat certain patients. And the main indication is of course these patients who are paraplegic after trauma of the spinal cord, car accidents for example, who maybe we can inject these multipotent cells, stem cells, make them direct into neural cells, and hopefully make them regenerate the lesion they have after this trauma, and maybe make them walk and have a normal life again. But I think we're still far from getting this to the real therapy. And then, of course, really ethical problems are there when we start using oocytes, eggs from human beings, and injecting them with sperm from, for example, animals, which the result we call hybrid embryos. I think this is one bridge too far for me to be ethically acceptable, but these things now with these new techniques can be done. Now, before ending, I want to give a little words about prevention. I think this is the most important thing in these new techniques, because it's important to avoid people to have to come to us because of infertility problems, so they can have a healthy life and avoid having fertility problems. And the first problem that we see is sexually transmitted diseases, which damage the tubes of the women and damage the sperm of the man. And by avoiding sexual STDs, by using condoms, barrier methods, by having intercourse, by having sex, we can avoid these problems. Another problem is age of the woman. The older the lady gets, the more difficult it is to get pregnant. So the message is, if you want children, start as soon as possible with these children. Don't wait after 40 years, because then it's becoming very, very difficult. And another problem is smoking. In Europe, this is a terrible problem. A lot of women smoke in Europe, but I see here in Africa that it's picking up also. A lot more women are starting to smoke. And smoking, the nicotine, is damaging the eggs. A woman who smokes goes into menopause 3-4 years before a woman who does not smoke. And a woman who smokes has 6 months more time needed to get pregnant than a woman who does not smoke. So smoking, if you want children, is something not done. And I'm afraid that in Africa this will increase, and that will be the next problem. And then the last problem is body weight. If you are too slim or too heavy, this increases also your chances for infertility. Too slim women, nature prevents them to fall pregnant because they do not ovulate. Patients who are obese, nature prevents them for not falling pregnant also. And to keep a normal weight is very important to become pregnant. And I think we here have given a lecture about the new techniques of IVF, the new things that we are coming now on the market. As I said in the introduction, I think it's very important to keep it a little bit away at the moment, because these techniques are very new, very promising, but most of them are very expensive, and we're not sure that they really are going to give what they promise to give. And then I think the most important thing is for patients to avoid that they need these techniques by living a healthy life, by not having a normal weight, not to smoke, avoid sexual transmitted diseases, and for women not to wait too long to have their children. Thank you very much.
Thank you so much for watching Faith and Science. Your calls and SMS have made a very big difference. At Faith and Science, we are about revealing God's wonders. Remember, we are fearfully and wonderfully made in His own image. Come, let us study the Word of God together at Women Hospital International every Wednesday, 12:30 to 2 p.m. For prayer and counseling, you can call, email, or visit our website. Be sure to watch Faith and Science with Dr. and Mrs. Tamale Sali of Women's Hospital International, Bukoto. We love you so much. May the Lord always bless you.